Safety in the clinical laboratory. So laboratory safety, key points, most laboratory accidents are actually preventable. Um, Preventable by exercising good techniques, making sure you're staying alert and using that common sense. As far as regulatory stuff goes, we have OSHA, which is the Occupational Safety and Health Administration. Their purpose is to ensure safe and healthy working conditions. So responsibilities in the lab, it provides a safety standard and regulation, requires proper labeling and handling of hazardous materials, and it mandates training in proper PPE, which is personal protective equipment. We also have to follow CDC guidelines, which is the Center for Disease Control and Prevention. Their purpose is to protect public health, including laboratory safety from infectious agents. So the lab guidelines for them include biosafety levels 1 through 4, and that's classified based on the lab safety, based on the risk of the level. And we also have an emphasis on containment, training, and safe handling of biological materials. So for core safety practices, we have good laboratory techniques. So we have proper use of equipment, making sure we have clean and organized workspaces, and also making sure that we are correctly labeling our chemicals and, of course, our patient samples. Alertness, we have constant awareness of our surroundings, making sure that we are prompt when reporting of any spills or broken glassware, or if our equipment is not working appropriately, and making sure that we are understanding emergency procedures. The common sense back to that is no food or drink in the lab. It's kind of gross when you think about it. Making sure you wear your proper attire, like your gloves, lab coat, goggles, face shield, that type of stuff if needed. And making sure that we are following all of our protocols exactly as stated in the manuals. And then we also have ergonomics. Ergonomics is designing the workplace to fit the user's need. So sometimes that includes certain chairs, making sure you're having proper posture when using microscopes or pipettes. As I mentioned, the chairs, making sure that your benches are at the appropriate height so we're not, having to hunch over or be up on our tippy toes, and then trying to prevent the repetitive strain injuries that can occur in the lab as well. And why this matters is because long-time lab work can actually lead to musculoskeletal disorders without proper ergonomics. So we want to make sure everyone is safe for the long haul. Excuse me, lab safety regulatory organizations. So most, like I mentioned earlier, most labs accidents are actually preventable. So ones that we will actually look at, so lab safety, understanding the roles of various organizations is essential for maintaining that compliance and ensuring safety in the laboratory. So as mentioned earlier, we have OSHA. They enforce the workplace safety laws. They will look at our lab safety standards. So if we have a hazard communication standard, bloodborne pathogen standard, they'll also look to make sure that we are using the appropriate PPE and that staff has been trained on that as well. Also for safe handling of the chemicals and biological materials too. So they're going to make sure that we have certain things in place to protect not only ourselves, but others that may come into the lab. And as mentioned earlier, CDC, they play a big part in the national public health. They help provide guidance on infectious disease control and laboratory biosafety. So the biosafety levels, like I mentioned earlier, is 1 through 4, and that's for handling infectious agents. And then there are guidelines for handling those as well, which I think we'll talk about later. If not, I know it is in your book, so go ahead and take a look at that. But each lab that you work in will have guidelines for that as well. Certain things have different transportation requirements and things like that. Then we have the Clinical and Laboratory Standards Institute, or the CLSI. They develop voluntary consensus standards and guidelines for clinical labs. They will help with laboratory, or overlook, I guess, or oversee rather, laboratory testing quality and safety procedures, and they will provide best practices for pre-analytical, analytical, and post-analytical phases of testing. Then we have the College of American Pathologists, or CAP. They are one of the accrediting bodies for clinical laboratories. They offer laboratory accreditation. They can conduct proficiency testing and inspections on labs as well. And they are around basically to promote continuous quality improvement. And then we move on to the Joint Commission. They accredit healthcare organizations, and they can also accredit hospitals and labs as well. So they will kind of do the same thing as CAP. They'll evaluate the safety, quality, and performance. They are also going to promote continuous compliance with the standards, and they're also going to set standards that can often exceed the minimum federal regulations. So that's kind of sort of like what CAP does as well. Then we have the National Healthcare Safety Network. It is a voluntary surveillance system that was developed by the CDC's Division of Healthcare Quality Promotion. It was designed to integrate multiple legacy surveillance systems into one platform. So it monitors safety across devices, patients, and healthcare personnel. The purpose is to provide standardized data collection and reporting tools for healthcare-associated infection tracking. Also supports facilities in improving patient safety, occupational health, and infection control practices. So some contributions that it has given is it has data-driven decisions. So that helps to facilities and public health authorities make evidence-based safety improvements. It also helps to support accreditation and compliance. So the NHSN reporting is often used by the CMS, which is the Centers for Medicare and Medicaid Services, and Joint Commission. It also enhances infection prevention programs in the lab and healthcare settings. So who uses this? It is generally hospitals, outpatient surgical centers, dialysis centers, clinical laboratories, long-term care facilities, places like that. Nosocomial infections. So we'll just get into that real quick here. So that is also known as a healthcare associated infection. So that is something that they get while they are in the hospital. So that moves us into the CDC's National Nosocomial Infection Surveillance System findings. Surveillance system is managed by the CDC to track those healthcare associated infections in the U.S. hospitals. Survey results will indicate the highest infection rates. They occur in the burn ICU units, neonatal ICU, and pediatric ICU. These settings usually involve vulnerable populations with a weakened or developing immune system. So prevalence of healthcare associated infections is estimated to occur in about 5% of all acute care hospitalizations in the United States. They contribute significantly to the morbidity, mortality, and healthcare cost as well. So some risk factors for nosocomial infections. Risk factors for invasion of colonizing pathogens are generally grouped into three major categories. The first one is iatrogenic, risk factors. It's a direct result of medical intervention. So they have had an invasive procedure like surgery, administration of antibiotics, which leads to resistance, or immunosuppressive therapy. The second one is organizational risk factors, which is a system level and facility related risk. So having inadequate staffing, staff using improper hand hygiene, lack of infection control policies or adherence to those policies, and overcrowded hospital conditions. The third one is going to be patient risk factors. That is characteristics that make patients more susceptible, such as age, if they're very young, very old, if they have a compromised immune system, chronic illnesses, or malnutrition. So some prevention and control strategies. So to reduce the occurrence of healthcare associated infections, we like to look at making sure that our staff are using a strict adherence to infection control protocols. They're there for a reason, so make sure we're using them. Hand hygiene compliance, making sure everyone's using their PPE and using sterile technique where needed. Antimicrobial stewardships. So using, antibiotics only when needed, not if it's a virus, because it's not going to do anything anyway. It's just going to make those bacteria mutate and cause issues. Also having environmental cleaning and disinfection. So that's kind of things that we will do with those. And then we have, like I mentioned earlier, OSHA, a key legislation and standards of this, so Occupational Safety and Health Act of 1970. Its purpose was established OSHA and laid the groundwork for workplace health and safety standards. It applies to all employers and their employees, including those in clinical and research laboratories. And then we had the Hazard Communication Standard in 1988, also known as the Right to Know Law. This requires proper labeling of chemicals, having SDSs or safety data sheets for all hazardous substances available to employees, and making sure that all employees are trained on chemical hazards as well. OSHA mandated safety plans for clinical laboratories, so all laboratories must have a written and accessible safety plan to protect staff from chemical and biological hazards. So the first one is a chemical hygiene plan. It's a written program to protect employees from the health hazards associated with those hazardous chemicals, and it would include your standard operating procedures or your SOPs. Exposure limits, so some things you can only be around for a certain amount of time, like radiation. Use of PPE and engineering controls, and employee training. And then we're also going to have an exposure control plan, which is a plan that minimizes or eliminates employee exposure to the bloodborne pathogens. And this is going to include universal precautions, engineering and work practice controls, PPE use, and hepatitis B vaccination offering. The SDSs, like I mentioned earlier, are safety data sheets. They used to be known as MSDSs, but they are just SDSs now. But these need to be on file and readily accessible to all employees at all times. So it can't be in a binder in the manager's lab or office, when they leave at night, third shift wouldn't be able to access it. So we need to make sure that it is available to everybody. And that's because these SDSs actually provide, critical information about chemical hazards, handling, and emergency measures. So roles in maintaining laboratory safety, we have a safety officer usually. They are responsible for initial safety orientation for new staff. They're also responsible for periodic safety updates and retraining, oversight of compliance with OSHA and institutional safety policies. We have safety coaches. These are usually volunteers from the lab team who take on additional, safety responsibilities. They'll act as peer leaders to help promote that safety culture and assist in monitoring and modeling safe practices. All right, so I got a little ahead of myself in the other slide, so we'll just kind of pass by this one since it's the same information. All right, biohazards. This refers to infectious materials or agents that present a risk or potential risk to the health of humans or animals working in the laboratory. The term risk is actually defined as the probability that a health effect will occur after an individual has been exposed to the specified amount of hazard. So laboratories must carefully assess this risk and ensure proper safety measures are in place. The CDC classifies bioterrorism agents into 3 categories based on their threat level. So we have category A, which are agents that pose the highest risk due to ease of spread and high mortality rates. Examples of this would be like anthrax and smallpox. Category B is agents that are moderately easy to spread and cause moderate illness. So salmonella would be an example of this. And then category C is the emerging pathogens that could potentially be engineered for future use, like hantavirus. So to manage these risks, laboratories follow biosafety levels from 1 to 4, which corresponds to the containment and safety practices required based on the infectious agent handled. So the biosafety level, or BSL-1, is basic precautions for low-risk agents, including standard hand washing and surface disinfection. BSL-2 is moderate risk agents requiring use of personal protective equipment, biosafety cabinets, and sharp safety. BSL-3 are agents that can be transmitted via respiratory routes, necessitating, there we go, controlled access, specialized ventilation, and enhanced PPE. And then we have BSL-4, which is the highest risk agent with no known treatment or vaccine. It will require full body suits, airlock entry, and specialized containment facilities. An important component of biosafety is performing a risk assessment. This process helps laboratories identify specific procedures or specimens that may require higher levels of biocontainment or additional safety measures. So by evaluating potential hazards, labs can actually tailor their protocols to ensure safety in sample handling, waste disposal, equipment use, and emergency response. Laboratory-acquired infections can occur when laboratory personnel are exposed to infectious agents during their work. The most frequent routes of exposure and accidental inoculation can include inhalation of infectious aerosols, percutaneous inoculation, such as needle stick injuries or cuts with a sharp object, contact between mucous membranes, so your eyes, nose, mouth, and contaminated material, ingestion of infectious materials, so bloodborne pathogens, they are a significant concern. Obviously, in the lab, it can happen at any time. So that's where in occupational exposure to bloodborne pathogen, it is defined as, I mentioned earlier, we have a percutaneous injury, the mucous membrane or non-intact skin issue. The exposure involves blood, tissues, blood-stained body fluids, or other bodily fluids that are covered in a standard operating procedure or standard precautions. So contact with the concentrated virus, these exposures underscore the importance of strict adherence to safety protocols to protect laboratory staff from infection risk. So the likelihood of infection after exposure to blood infected with hepatitis B or human immunodeficiency virus depends on a lot of different factors. It will depend on the concentration of the virus present. Typically, hepatitis B has a higher viral concentration compared to HIV. The duration of contact with the infected blood, the presence of skin lesions or abrasions, the immune status of the healthcare worker. So that's, why it's very important, that they have immunity to this or have that vaccine. It is important to note that most exposures do not result in infection, but understanding these factors helps guide preventative measures and post-exposure management. Personal protective equipment, PPE, plays a crucial role in ensuring the safety in laboratory personnel. Proper selection and use of PPE minimize the risk of exposure to infectious material and other hazards. Key components of the PPE include gloves, so making sure you're using the appropriate ones there, having facial barrier protection and occlusive bandages. These help prevent exposure to infectious agent through mucous membranes or skin breaks. Using your lab coat or gown as needed, as well as is up there. Some other important factors to consider for maintaining lab safety is nail care. So making sure you're keeping your nails short and clean. That will reduce microbial harboring. Shoes, making sure you're wearing appropriate footwear to protect against spills and injuries. Electronic devices and hand washing. Decontamination is another one as well. So making sure that we're cleaning our work surfaces, equipment, and spills appropriately. All right, so decontamination of work surfaces, as mentioned earlier, we want to make sure that we, clean the way we're supposed to. So disinfection is the process that eliminates many or all pathogenic microorganisms except bacterial spores from inanimate objects. In the healthcare setting, disinfection is typically achieved by using liquid chemicals or a wet pasteurization. Disinfecting solutions commonly include hypochlorites. And the procedure, so making sure you follow the procedure on your cleaning container. A lot of times, and you can go look right now if you have Lysol in your home, it will probably say that that area needs to remain wet for a certain amount of time, maybe 60 minutes or 60 seconds. Most of the time, a lot of people are going to spray and wipe right away. That does not work the way that it's intended. It's supposed to actually be wet. So spray the counter, let it stay wet for whatever that amount of time is, and then wipe it down. So that's always kind of an interesting thing that most people miss. So make sure you look at that. Also making sure if we have disposable labware or supplies, those that have come in contact with blood should be autoclaved or incinerated, and that helps to prevent contamination. Pipetting safeguards include the use of automatic devices to reduce the risk of exposure to hazardous materials. Safety manuals provide guidelines to ensure proper lab practices. Sharp safety and needle stick prevention are, a critical component of lab safety. The use of special sharps containers will allow for quick disposal of needles without recapping, and that will help to ensure the safe disposal of other sharp devices that could be contaminated with blood as well. So it's important to never recap, bend, break, or manipulate any sharp needle or lancet device by hand. You can poke yourself or somebody else. It's just not worth it. Use that safety, device that we have on the needle, throw it in the sharps, you're good to go. Specimen transport and handling. So specimens should be transported to the lab in plastic leaf-proof leak-proof bags, and these usually have like a biohazard symbol or something on them as well. Protective measures such as gloves should always be worn when handling any type of biological specimen. And then we're just going to take note of Zika virus. I'm sure you guys have heard of it. It was big in the news, I don't know, maybe 10 years ago or so. And this is classified within the United States as a Category B biological substance, and it can spread pretty easily. So all right, safety practices. All devices that come into contact with blood and have the potential to transmit infection to the donor or recipient must be sterile and designed for single use only. So to maintain a safe lab environment, food and drink should never be consumed or stored in the work areas or anywhere near specimens. Containers, refrigerators, or freezers that are used for storing specimens must be clearly marked with the biohazardous label to prevent contamination and ensure safety. And a lot of times, these will have stickers on them as well that say no food or drink on them as well. Specimen handling. Specimens requiring centrifugation should be properly capped and placed into a centrifuge with a sealed dome, and that helps to avoid spills and aerosols. Opening test tubes, so they're rubber stopped test tubes must be opened slowly and carefully. And we want to do this by using a gauze square over the stopper when you're opening it, and that just helps to minimize the production of aerosols as well. Autodilutors or safety bulbs should always be used for pipetting, as pipetting any clinical material by mouth is strictly prohibited to avoid contamination and infection. That should be, an easy one. There's that common sense coming back, right? They did used to do that. So if anyone works with someone who's been in the lab a while, you can ask them, and they may have been a part of that. The use of tobacco products in the lab is not allowed. And additionally, personnel should avoid manipulating contact lenses, using, makeup or anything like that in the lab should also not occur. All lab staff must be familiar with the locations and proper use of eye wash stations and safety showers to ensure quick response in case of exposure to hazardous substances. So you want to make sure you know where they are. You want to make sure you know how it works as well. So that should be part of your initial training when you start working in a lab. Pipetting, like I mentioned earlier, no mouth pipetting, use those safety bulbs or autodilutors. As mentioned earlier, no tobacco, no personal care like contact lenses or makeup, and making sure you know exactly where everything is as far as safety showers and fire extinguishers and things like that. Proper handling of blood and bodily fluids is essential not only to ensure the accuracy of lab test results, but also to guarantee the safety of all individuals who come into contact with the specimen. So when transporting blood specimens, the shipping container must comply with OSHA requirements for shipping clinical specimens. These containers must meet the packaging standards that have been set by, whichever courier you're using. They may all have just a little bit, of different criteria, but they're all going to follow, for the most part, the U.S. Department of Transportation guidelines. Let's see. Yep. To prevent disease transmission, there are immunizations that you can get, or you probably have already had. So hepatitis B, influenza, measles, mumps, rubella, and varicella. Some other optional immunizations are hepatitis A, meningococcal disease, pertussis, typhoid. Some other ones are like diphtheria and stuff like that. They're not always required. It just kind of depends on where you're working. Some screening tests that will occur generally prior to you working in a laboratory. They'll do some screening tests. So they'll do a tuberculosis test, test you for rubella immunity and hepatitis B as well. And then if needed, if you are exposed, there's prophylaxis that you can do in medical follow-up. So they would do, they would test you for hepatitis B, C, and the HIV virus as well. You can use respirators or mask for tuberculosis control. So if you are going to the floor to draw a patient with suspected tuberculosis or working on a sample, especially like a sputum or something, you would want to wear the appropriate attire and use, the appropriate safety stuff, such as a biosafety cabinet. And patients are generally in a negative pressure isolation room as well. Some additional lab hazards are chemical, electrical, fire, labware, and infectious waste. So for the chemical hazards in the lab, it includes, a huge range of specific hazardous chemicals such as sulfuric acid, nitric acid, um, trichloroacetate acid, ethers. There's a whole bunch of them. I'm sure you guys are aware. So among these, some chemicals are classified as select carcinogens, which are substances known to cause, potentially cancer. So when handling any potentially hazardous chemical or solution, it's important that we take those protective measures. This includes wearing the appropriate PPE, such as gloves, face shield, whatever you need to do depending on what it is. There could be volatile or fuming chemicals, and they should always be used under a fume hood to minimize inhalation risk. In the event of accidental contact with a hazardous chemical or contaminated substance, prompt action is going to, be required, and that's to help reduce harm to you. Um, Electrical hazards in the lab can lead to shock or fire if proper precautions are not followed. So OSHA regulations require that electrical equipment is grounded in accordance with the National Fire Protection Association's National Electric Code. Although some local codes, may be more stringent than that, they at least have to meet the minimum. All electrical equipment used in the lab must be approved by underwriters' laboratories to ensure safety standards are met. There should be regular inspections of electrical equipment, and that will help to reduce the risk of electrical accidents. Fire hazards. So fire safety in the lab is also critical. We don't want a fire. It can, hurt and or kill people and property. So all staff must be trained in the use of fire safety equipment and procedures, with annual retraining being mandatory. Each lab should be equipped with devices to extinguish or contain fires, both within the laboratory and on clothing. Safety showers are essential for quickly rinsing off chemicals or fire, and fire blankets must be easily accessible. They're generally stored on the wall in a wall-mounted cabinet somewhere. So an easy acronym to remember when using a fire extinguisher is PASS, and that stands for pull the pin, aim at the base of the fire, squeeze the handle, and sweep the extinguisher from side to side. There are different classifications of fires. So we have Class A, which are generally ordinary combustibles like wood and paper. Class B, which are flammable liquids and gases. Class C is electrical equipment. Class D is combustible powdered metals. And Class E is fires that cannot be extinguished by conventional means. Labware hazards. So again, lab personnel need to exercise caution to prevent unnecessary or accidental breakage of labware. Most labware in use today most of it is disposable and should be discarded if it's broken. If there's any broken or cracked labware, it must be disposed of in a special container designated for broken glass and never thrown into regular waste containers, because that can cause injury. If the glass is broken, someone picks it up and it stabs their leg through the bag or something, that would not be good. So there's common sense that should help guide the storage of your labware. So if you have heavy items, they should be placed on lower shelves. It's easier to get to. While tall pieces should be positioned behind smaller ones, and that helps to prevent tipping or falling. Additionally, shelves should be installed at reasonable heights to ensure that labware is stored within easy reach, and that will also minimize the risk of accidents. Infectious waste. So OSHA regulations cover human blood, human infectious waste, and human pathological waste to ensure proper handling and disposal. Many states actually extend these regulations to include medical waste or blood from animals as well. So to prevent exposure and contamination, body fluid specimens, including blood, must be placed in sturdy biohazard containers with secure lids to prevent leakage during transport and disposal. For disposal, these plastic biohazard bags are suitable for most infectious waste materials, but rigid, impermeable containers are required for sharps like needles and broken labware to ensure the safety and prevent more injuries. Most labs will generate three major types of waste streams. One is non-regulated waste, and then regulated medical waste and chemical waste. So regulated medical waste is further divided into two categories: biohazard waste and biohazard sharps. The control and proper disposal of infectious chemical and radioactive waste are regulated by a lot of different government agencies such as OSHA and FDA, and that helps to ensure safety and environmental protection. Infectious waste so must be discarded in proper biohazard containers with these characteristics. So it has to have a clearly marked biohazard and universal biohazard symbol. It has to display the universal biohazard colors, which are orange, orange and black, or red, and the containers must be rigid, leak-proof, and puncture-resistant. So commonly used containers include cardboard boxes that are lined with a leak-proof plastic bag. Used for disposing of blood, certain body fluids, disposable materials that are contaminated with blood and fluids. Radioactive waste, we don't have much of it in the lab, but it can happen. So disposal is regulated by the Nuclear Regulatory Commission. Waste is generated from the radioimmunoassay laboratory methodology, and that requires special caution during disposal due to its radioactive properties. So if your lab uses this, you'll know. Safety audits, lots of times the lab's going to go through and make sure everything is working the way it should, and if not, do more training. So lab coats, we need to make sure that we have clean coats, and they must be stored separately from coats that are currently in use. Fire extinguishers must be regularly inspected to ensure they are within the expiration date and they can be used when needed. Biosafety cabinets and hoods, they require annual certification to ensure proper function and safety. Your eye wash stations and safety showers must be located within 100 feet or no more than a 10-second walk from areas where these hazardous chemicals are used. Chemical inventory, generally there is an annual inventory of all chemicals that are within the lab, and then that goes down into the SDSs, or the safety data sheets. Those need to be updated annually as well, because you may bring in new chemicals, take out some chemicals, things like that. So we want to make sure it's always updated. Again, these must be readily available either as hard copies or electronically, and accessible within 5 minutes of any request. Basic first aid procedures. So the first priority is to remove the accident victim from, more injury. We're going to follow this by providing definitive action or first aid to the victim. Key rule in the lab emergency is to keep calm, and this is kind of true of any emergency. If you start spiraling, it's going to get worse. Due to the severity of some injuries and the importance of immediate care, all lab personnel must be thoroughly trained in proper first aid procedures. So if we have burns on the skin from alkali or acid burns, we want to make sure we rinse thoroughly with large amounts of running tap water. We're going to seek medical attention if the burn is serious. If there are burns in the eye, we want to wash the eye thoroughly with running water for at least 15 minutes. You're going to hold the eyelid open to ensure that water, contacts the entire eye. You're going to want to use an eye fountain if available, or an eye wash. But if there's not one for whatever reason, running water from the faucet, from a sink, is sufficient. You want to avoid using an eye cup, and you want to notify a physician immediately while continuing to wash the eye. Heat burns. If there's a burn, you want to apply cold running water or ice in water to relieve pain and prevent further tissue damage. You want to use a wet dressing made of 2 tablespoons of sodium bicarbonate in 1 quart of warm water, and then apply that bandage securely but not too tightly. If there's third-degree burns, you're going to want to seek medical attention. It's beyond what we can do in the lab. Serious cuts, you're going to apply direct pressure on the wound with a clean compress to control the bleeding. You're going to use the hand to maintain pressure over the wound and then call for a physician immediately. If it's just a minor cut, you want to wash the wound thoroughly with soap and water. Remove any foreign material projecting from the wound without, gouging it further, and then apply a clean bandage if necessary.